Welcome, food management readers. Becky Schilling here, and today I'm really honored to have my good friend Angela O'Neill with me today. She is the Director of Nutritional Services at Hunterdon Medical Center in New Jersey. Welcome, Angela.
Thank you, Becky. I appreciate being here.
Appreciate it. I know that you guys are going through a lot right now. Can you just talk to me about how you're doing?
Sure. The last month's been a whirlwind like the rest of the world, and we're getting used to our new normal, but our new normal changes every day. So being ahead of the curve and just keeping on top of things, and the communication at our organization is really great, and we have really good teamwork. So it seems to be working for us, but you know, there could be paths down the way that might surprise us, but hopefully we're ready for whatever comes our way.
Yeah. And so you kind of talked about this adjusting to the new normal. What are some of the things that you guys have had to kind of work with on the fly?
So in our food service, we have both patient care and our retail sales. So with the patient side, we basically had to come up with a way to provide room service still to the patients. This was about a week into everything, but then allow nursing who hadn't for years to pass the trays so that we could provide the service, but keep our PPE to a minimum of trips going up to the rooms. So it kind of shortens our time. Nurses had to adjust to doing that. We seem to be doing much better. And then we also had to find a new way to provide a disposable tray. Don't know if you realize that disposable trays are not available right now in the marketplace for the most part. We always, all our isolations were always on regular trays. So it wasn't something I gave any thought to in the beginning, but when I started our disposable trays and we tried to order them, we just couldn't find them because other parts of the country were already utilizing them. So we actually came up with a really great idea to use a small paper bag, like a grocery bag with a handle, and we take and put a small clamshell in there with their entree, use a beverage caddy, and in the beverage caddy, we put their beverages and like their jellos and their ice cream and other things, and we staple their ticket to it and send it upstairs. So we haven't gotten any complaints, any pushback, which is awesome. I think the patients realize and understand. And right now, we're probably at a half of our house is on disposable trays or bags.
Okay. And the disposable bags, is that for all patients or just COVID patients?
Just COVID patients.
Okay. And tell us, how big is your hospital? How many beds?
We're 178 licensed beds, but recently we actually expanded 93% our capacity at this point. We had 2 units that were old patient units that actually had just closed when I started here in 1992, that they were office areas and our sleep center, and they came along and took everything out of them and now have retrofitted them for a possible surge. Those beds might be used by the state versus internally here by our staff. And then we also on our inpatient side have found areas like endo, our same-day surgery, our cardiac pulmonary rehab that we are turning into patient units. So I think it was like 360 some odd beds that we potentially could have should we need them.
Wow, that's a big increase.
Yeah, and our governor actually tweeted about it last week about how he was impressed by what our organization has done. So that's a good feel.
Yeah. And I know that you talked about the shift in room service and having nursing be the ones who are actually delivering to the patients now. What other kind of staffing shifts are you making or changes to, you know, ensure the safety of your food service team?
So in order to cut down on number of staff here or hours that they were here, we adjusted. We actually reduced some hours in our cafeteria and our patient side so that because they weren't needed here as many hours, so that way they were not in contact with each other as much. Several weeks ago, we went to where all staff, if they were not able to maintain social distance, have to wear a mask. If they're going anywhere up on the patient units, they have to wear safety glasses and gloves. And then they also in like the warewashing area have to, because any trays that or anything that's been up to a patient unit, we're treating with suspicion of. So they need to protect themselves with those gears. And our cafeteria side, that was immediately a lot of changes because of the social distancing. So we don't have a huge cafeteria. We immediately on March 10th went to getting rid of our salad bar, self-serve, because of the stuff. Everything went to packaging. We made that change basically within hours. Decision was made on a Monday afternoon, and by Tuesday morning we were ready to roll. So my team did a great job, and actually I wasn't even here on that day, so they did an awesome job. I was returning from a conference. And then that week we also put in social distancing for a lot of the chairs. We marked the floors with X's as to where chairs could reside. And then on the floor, it's almost like one big hopscotch grid. We have X's where patrons can stand along the area where they're picking up their to-go items, or in the hotline and at the registers, so that we've created kind of guidance for them as to where they can go before they can move for the next person to go through the line.
That's great.
We did a lot of that. Yep.
And what's kind of the hardest challenge that you guys are working through right now?
I don't want to say anything was extremely hard. I think it's just having the time to do what you're asked of. My team is very awesome. And actually today we were asked, and I had seen some things through my colleagues, that they're offering markets with the bread and the eggs and all that. And I had thought about doing it, but I was a little hesitant because I wasn't sure if we were going to get a surge, and, we needed to take care of the patients. To make sure but by Thursday, we are going to open a part of our cafeteria to offer those things as staff. My management team was right on top of it, all willing, thinks it's a great idea, and is on top of it. Sometimes you just want to have a little bit more time to plan, and being a type A personality that I am, I do like planning, but sometimes you just don't have the time, so you just go ahead and go with it, and hopefully you work out the kinks as you go along.
Yeah. Any lessons that you've learned there in your operation, or that you've learned from some of your colleagues and have used?
I'd have to say that knowing what it's always good to have a crystal ball, but listening to what other people are saying, because then you could be ahead of those shortages, and being able to be flexible. Some of our suppliers aren't able to give us what we need, and we understand, and they're trying their hardest through US Foods or paper goods, but be flexible to try an item or work around something, and you can still provide the service and the products. You just have to figure out a way to do it. So I think a lot of what my colleagues are doing, I'm listening to. So this way, if it comes that we need to do something, I'm applying it, I'm going with it. We had to do a menu for non-select in case these units open that the state uses. There's not going to be phones in the rooms. So we're going to have to provide them 7 meals a day, non-room service. So it's one of those, you go with it and you figure it out, and you talk to other people, and you utilize what's out there. I think we all have great ideas, and some of the resources I have at my hands to tap into those ideas are awesome, and I'm very thankful for them.
Yeah. And we hear so much about the nurses and the doctors who are on the front lines, but you and your team are right there on the front lines as well. How is this impacting you guys kind of on that personal level? Are you guys hanging in there?
We definitely are. I'm very, very grateful that my staff is willing to come in every day, and yes, they have their own concerns that they're in a hospital building and could their chances be higher, but they are all dedicated, just like the nurses and doctors, and are putting everything forward, and we're trying to do things to help them. Our organization right now, we're getting such an outpouring from the community of restaurants that are delivering meals to our units but we came up with, if a unit isn't getting a planned free meal for the day, we're sending up a list of what we have in the cafeteria. Circle it, tell us what you need, we'll send it up to you. We'll, you know, get the meal to you. So I think our staff feels that they want to keep doing more because they're not the ones doing the hardest job in the organization, but they want to support those that are.
That's awesome. And that just speaks to the kind of leader that you are there at your hospital and how
Thank
wonderful
you.
it is.
Thank you. Thank you, Becky.
Yeah. So thank you so much for being here, Angela. I know you guys are super busy. Thank you for your time.
Thank you. And stay safe, wash your hands.
Yes, definitely.
Have a great day.
Thanks, you too.
Bye-bye.